Hello, my name is Faustina Ikizi, and I am a nursing student from Indiana State University. Sickle cell disease is the topic of my presentation today. This is part of my clinical health education project for now 444 Community Health Nursing class. Now, who are those at risk for sickle cell disease? The population at risk for this topic, sickle cell disease, are African Americans and Hispanic Americans, particularly infants and children, as well as adolescents and adults. Across the world, sub-Saharan African, the Middle East, the Indian subcontinent, and parts of the Mediterranean are among the areas where sickle cell disease is prevalent. At the end of this presentation, learners will be able to describe the basic causes and risk factors for people with sickle cell disease, recognize signs and symptoms of sickle cell disease as well as indications of the crisis, learn about sickle cell traits and how to identify individuals at risk. Parents, teachers, and caregivers will discover helpful strategies and be better prepared to provide individualized treatment and management plan for sickle cell patients. Recognize the disease pattern in America and how it impacts other countries. And finally, encourage medical professionals to engage in research and development to lessen the effects of sickle cell disease on the patient. Please click on the link to check your knowledge on this topic. What is sickle cell disease? Sickle cell disease is one of the numerous kinds of blood disease. This disease is inherited from one's parents. Those with sickle cell disease have a high concentration of abnormal hemoglobin S in their red blood cells. Its lifespan is less than regular red blood cell, causing anemia. The shape also prevents red blood cells from flowing freely through the vessels. This disease is usually diagnosed as a newborn child or even before birth, depending on the circumstances. What are the facts about sickle cell disease? Sickle cell disease is prevalent among African Americans and Hispanic Americans. Overall, about 100,000 Americans experience sickle cell disease. According to CDC, one in every 365 African American and one in every 16,500 Hispanic American births has sickle cell disease. Also, one in every 13 African American children has sickle cell trait. Besides Americans, other continents are affected by sickle cell disease. Sickle cell disease affects 3% of African infants, and there are 6,000 births each year in Latin America. The Middle East and India, the Caribbean, and the East Mediterranean has high incidence of sickle cell disease. What do we know about sickle cell trait or carrier? Sickle cell trait, also called sickle cell carrier, develops when a person possesses one sickled or deformed hemoglobin gene and one normal hemoglobin gene. Individuals with a sickle cell trait can go about their everyday lives without showing signs and symptoms of sickle cell disease. But person with sickle cell trait has a chance of passing the trait on to their offspring genetically. There is a 50% chance that a child will be born with the disease if one parent has the disease and the other has the trait. Causes of sickle cell disease. The only way to get sickle cell disease is either through inheritance or gene mutation. In other words, the disease has been handed down to them from their parents as a result of their genetic composition. To be born with the disease, a child must have one set of sickled or deformed genes from both parents. Additionally, some people acquire gene mutations when their red blood cells get hemoglobin S, which is the faulty hemoglobin. What are the signs and symptoms of sickle cell disease? Symptoms typically develop during the first year of life and may be mild or severe depending on the individual. One of the early signs is jaundice, the yellowing of the eyes or skin. Patients experience severe pain in joints, chest, and abdomen, as well as swellings in their hands and legs. Recurrent infections are also typical. Vision problems, slow growth, delayed puberty, as well as anemia. Therefore, any of these symptoms or a combination of them may be a red flag that requires doctor's attention. Let's talk about sickle cell crisis and its symptoms. Patients with sickle cell disease frequently face sickle cell crisis, and it is the major reason why patients seek emergency care. And severe pain caused by blood vessel occlusion is the major contributing symptom with sickle cell crisis. Anemia can cause fatigue, dizziness, and headache. Male patients may have pain during erection, and some patients might get jaundice. Certain triggers can cause sickle cell crisis. Infection, insufficient oxygen, dehydration, sudden temperature change, air pollution, and excessive physical activities can trigger crisis. Other triggers include low blood cell count, mental stress, and fatigue. Therefore, daily stress management is required. What are the complications with sickle cell disease? Sickle cell disease may lead to severe consequences if not properly managed. There is a danger of anemia, organ damage, life-threatening infections, acute chest syndrome, stroke, and even death if not properly managed. Additionally, this illness can coexist with other diseases. Therefore, patients should manage other existing conditions to ease the discomfort on the patient. Management and treatment. While sickle cell deteriorates with time, it may be managed. Avoiding triggers is the key. Also, simple hand washing can prevent infection. Antibiotics, painkillers, and blood transfusion can treat complications. There are treatment options like hydroxyurea, L-glutamine, and currently stem cell or bone marrow transplant can cure sickle cell disease. Also following up with physical therapy, psychotherapy, up-to-date vaccines, annual eye check are positive steps to prevent patient discomfort. Also, it is critical to keep track of the child's progress. Patient needs to stay hydrated during exercises by drinking lots of water. Also, treating comorbid illnesses such as asthma, diabetes is also an informed preventive measures. The Education Management established the 504 plan, which allows students with special healthcare needs to access standard education programs, including home study materials, toilet breaks, extra water, and clothing. In addition, getting newborns and those intending to have children tested for weeks, regardless of ethnicity, as mandated by several states, is a great preventive measure. Finally, regular checkup helps patients stay ahead of the disease. What are the challenges facing the management of sickle cell disease? Socioeconomic status is a major factor affecting treatment and access to care. Poor family income, limited access to medication, health services, and food insecurity are global issues affecting patients, especially from underdeveloped nations. However, simple measures like proper hand washing, a hot bath, or just staying warm can help to manage the disease. In summary, sickle cell disease is a lifelong red blood cell disorder that affects people across the globe. People acquire it through inheritance. While sickle cell disease deteriorates with time, it may be managed and treated. Individuals can choose to combine several remedies to improve life quality. Essentially, people with sickle cell disease can improve their well-being through practicing healthy lifestyle. Please check your answer by following this link. Check out more information on this handout link. And here are the sources to this presentation. And thanks for watching.